Hi there, a very good evening to you and welcome. My name is Michael Etoro. I'm the Public Relations Officer of the Berbice Regional Health Authority. Thank you for joining us. This evening, for the next 30 minutes or so, we will be discussing developing mental health care in Guyana. And I tell you what, we have some very special guests joining me this evening in the studios at NCN. And to my left, let me introduce them to you. He's a homeboy who has migrated to Canada for many years, since 1977. And I'm just calling him Ram, but most of you on the quarantine will know him, coming from the Firish area. So welcome. He's a chaplain. He's also a psychotherapist who is a part of a very large team from Canada that continues to support us here in Ghana. And to my right, the very youthful Dr. Sujay Patel. He is a psychiatrist and he has been working very diligently with the team of 12 that is here in Berbice for the past couple of days. And to his right, the very lovely a registered nurse, Karen, and she is also a part of a very strong team that has come down to Guyana here in Berbice to work with us to help us develop mental health care in the region. Now, before we proceed, we'd like to remind you that the month of October, on the 10th of October, Guyana joined the rest of the world in observing World Mental Health Day. And this year, we focused on living with schizophrenia. And as part of, if you can recall, also the National Psychiatric Hospital, there was a week of activities where we were promoting the facility and the services there. Ladies and gentlemen, welcome. We also wish to say welcome and good evening to the rest of the team who are sitting out in the lobby. Hi, guys. A few of them will be slipping in and out. But I wish to move on with the program this evening and ask Ram to tell us a bit about the team and some of the things you've been doing since you've touched down in Guyana and your interest here with mental health.
Well, this team started last year when the group of 4 of us came and we basically scouted out. We didn't know what we were getting into, and lo and behold, a year later, here we are with a team of 20 individuals, professionals from Canada, and we split our team in 2. There's one part of the team that's in Georgetown, and they've gone to study, and they've gone to Linden, and we are a group of 12 who've been here working with the National Psychiatric Hospital, and we have done some assessment, and we've done some teaching as well, and it's just a phenomenal thing for us to be able to be here. And for me, it's a delight to come back to my home country, and it was very, very heartbreaking and at the same time heartwarming to see that my colleagues from Canada took their time off and make a concerted effort to be here and to support our people.
Well, thank you, Ram. And one of the things I must commend the group and you guys here and those who are listening is that the compassion with which you demonstrate for the clients at the National Psychiatric Hospital. And I want to bring in Dr. Sujay Patel. He's a psychiatrist. We've had some interesting lectures in preparing people for the reintroduction of ECT. And a lot of effort has been put into that. Many of you in the public who are listening to us would want to know what is ECT. But so far at the National Psychiatric Hospital, the therapies that we use, basically drug therapy, and also occupational therapy and some psychotherapy, we are reintroducing ECT. And it is electroconvulsive therapy. Dr. Patel, you're very passionate about this. What are your thoughts?
Yes, so Michael, we started about a year ago thinking about some of the things that we could do to help the mental health system here in Guyana, and we were trying to think about what are some of the cost-effective ways to treat individuals who have severe depression, knowing that depression and suicidal thinking and suicide is a critical issue right now for the people of Guyana. And We look at the alternative treatments that we provide in Canada and America, and ECT is one of the top treatments for depression, especially when it's associated with suicidal thinking. In fact, the rates of recovery after a series of ECT treatment are in the ranges of 75 to 85%. When compared to medications, you're looking at rates of just 40 to 55%, so quite low. So ECT treatment is very effective. It is cost effective as well. Once the individual human resources issues are settled, which we have here, the ministry has developed a team that we have trained. We've trained them by giving them a informal didactic teaching day as well as some technical teaching. Today, in fact, was our first ECT treatment in the country since about 25 years ago, and we had a series of 4 treatments today. They were highly successful. The patients are doing very well post-treatment. We followed up with them. They will still need to go through a couple more weeks of treatments. We hope that these individuals who had protracted symptoms of depression, some of them also with suicidal thinking and suicidal thoughts, are going to go into full remission from their illness.
All right, and so that today was really the highlight of your visit, because you've had many travails trying to get things going.
Our team has really shown some incredible perseverance and resilience. We have started this journey about a year ago, started with fundraising to purchase the ECT machine for Guyana. We spent a lot of time trying to develop the training curriculum. We had lots of different edits to our training program. Got here, we were met with a number of obstacles, but the team had the motto, never give up. And I am very proud to be part of this team that never gave up, and the success that we all feel today, not only the team here, but the Georgetown component of our team, we're all very excited because that was our number one goal. And the reason why this was our number one goal, we wanted to show our long-term commitment to Guyana by having this quick win.
Thank you, Dr. Patel. And we just want to go over to Karen. It is her first visit to Guyana, and if not anything, the cuisine has wooed her. She's very excited about Guyanese food.
It's delicious.
So Karen, welcome.
Thank you.
We're happy to have you. I'm sure you were greeted well by the mosquitoes.
Yeah.
and the locals here. But you are also a part of the educational component of this team, multifaceted team. Mm-hmm. And on Sunday, another very important aspect of your visit will be unfolding, where we'll have some lectures, the continuing medical education. Can you tell us a bit about that, some of the topics we'll be looking at?
Yeah, so Sunday we'll be discussing 5 different topics. Delirium, psychosis, we'll be talking a little bit about depression, antipsychotic medications in pregnancy, as well as ECT, of course. And the goal of that is kind of to create more discussion, raise awareness, just get people talking more, and hopefully have multidisciplinary team come in and learn more about it, whether or not they work directly in a mental health facility or if they're a general practitioner. It just helps to raise awareness and decrease a little bit of the stigma that's attached to mental health.
Awesome, and those are very, very good topics, especially for Guyana. And now we're also trying to let the medical fraternity know that ECT is back in Guyana. You being a registered nurse, care is very important for clients after the psychiatrists and the specialists would have done their job. How close have you been relating to clients who are going through ECT back in Canada?
So I have worked in the mental health unit in Kitchener-Waterloo area, the inpatient unit, and I've had experience for the last 8 years with ECT there. So I've seen quite a bit of improvements with patients who have come to have the treatment. So it's really nice being part of this team and having that experience to share with the nursing staff that I got to train this morning. It was a really great experience.
Well, thank you so much for your inputs. And if we can bring Ram back, you've had a lot of you visited many of the clients there at the National Psychiatric Hospital, had some interaction, lots of interests. What are some of the things that jumped out at you?
I was baffled, and at the same time, it was heart wrenching to see how we have facilities, and we have the capabilities of improving what we have. I think that the thing that challenged me the most was to see how those ones of our clients who have been improving are still within the same unit of those clients who've just come in, and and those who've been severely depressed as well. So it seems to me it just promotes continuously the state of mental illness. And it's amazing that I think one of the things that I'm not trying to compare, but part of the thing that Karen touched on it is having a multidisciplinary team that we work with. And myself as a chaplain, we have occupational therapists, recreation therapists, we have nurses, we have our psychiatrists, we have psychologists. You know, and it's not that we have an abundance of them, but collectively we work together as a team, and it's just remarkable to see. I do believe we were told that we do train social workers here, and coming here and seeing a lack of social worker input, or even occupational therapist input, I think that's something that we hear that I would really highly encourage and recommend that we get involved in. You know, to give our people a sense of ownership, a sense of responsibility, and a sense that, you know, you belong in society. And one of the ways of engaging them is to let them know that, you know, these are things that they can still do even though they're mentally ill.
All right.
They're not disabled. They're mentally ill. And we need to keep that in mind.
Yeah, thank you, Ram. Now, we've just had a change of seats, and Karen has left us, and she's made way for Dr. McCall, another psychiatrist, and she's been very passionate. Welcome. Welcome to NCN, and your thoughts about what has happened today, the team being finally able to get some work done, some serious work done. I know you've been really behind getting this happening.
Yeah, so I think I speak for the whole team when I say we are just really proud of being able to get this done, because as Dr. Patel said, we did face a number of challenges when we got here, and despite those, we have come together and made this happen in this country, and it's really very rewarding. And I gotta say, our team has made it happen, but also all of Guyana has really made this happen. The doctors, the nurses, the administrators, everyone has come together to make this a successful project, and I really am touched by how much everybody has really come behind this and to make Guyana's mental health better.
And as you continue, can you tell us a bit about how close have you been working with this particular therapy, shock therapy, and some of the results, and where are we going with it?
Well, I work in Ontario, Canada, and I've been doing ECT for the better part of 10 years now. So I have very well versed in it, and have seen remarkable results. And just like Dr. Patel rightly said, despite us using medications a lot of the times, ECT actually has a better success rate than medications with minimal side effects. And it is a very useful treatment and very cost effective, and at times it is really life-saving, and it really can have a major impact on the mental health care in Guyana and the suicide rate that I know everyone has heard about and is concerned about.
If we bring in Dr. Patel, when we've come from a culture and a tradition of a very bad experiences from what mental health care was to what it is today, and so we have remnants and fragments of those images. And so when we begin to talk about shocking people, there is such a negative picture in your mind. But how do you describe to the listener, the viewers of this program, ECT as a very highly recommended treatment from that background that I just gave you?
Yeah, fortunately, ECT probably around the world has the unfortunate bad image, and I think, media has done some great things for mental health, but for ECT, it's not done a very good job. If you ask most psychiatrists who understand the science and evidence behind ECT, I would say that probably close to 100% would say, if I was depressed and I was suicidal, give me that treatment fast. So if you're medical professionals or specialists who would do it to themselves, then I think that's saying something about the type of treatment. The stigma attached to ECT is unfortunate. It has a long history, 50-year history, and it's gone through changes. Certainly in the early days when ECT was delivered, it was done in somewhat uncomfortable ways to patients. Patients were getting the ECT without any appropriate sedation or anesthesia. We've modified ECT in the modern century. ECT is now done in an extremely humane way. The patient is put to sleep by an anesthesiologist. The individual completely feels no pain, nothing at all. They'll wake up after the ECT is delivered and the anesthesia wears off, and they won't even recall what happened to them. The body is controlled with special medications that the anesthesiologist will give. So the seizure that occurs is a seizure in the brain.